quietly putting your health at risk without you even realizing it? It sounds surprising, but according to the Centers for Disease Control and Prevention, over 70,000 older adults die in their sleep each year in the United States. What's even more alarming is that a lot of these deaths are not just due to aging. They are linked to small, fixable habits that many people never think twice about. As we get older, our bodies change in ways that can affect our sleep. For example, our hearts can become more delicate, our lungs may react differently, and our brains can be more sensitive to disruptions. Because of these changes, sleep becomes lighter, and those little things we used to do at night, which seemed harmless, can now become serious threats to our health and safety. So today we'll explore 7 common sleeping habits that seniors should avoid immediately. You will want to pay special attention to habit number 2. It's surprisingly dangerous, but don't worry. I will also share simple steps you can take to protect yourself starting tonight. If this is your first time here, we're glad you found us. Hey everyone, welcome back to Bloom and Nourish. Take a moment to like this video and subscribe to our channel for more helpful tips on leading a healthier life. Also, let us know where you're watching from by dropping your country in the comments. We love seeing our community grow. Now, let's get started. Habit 7. Drinking too much water before bed. Let's talk about a habit that may seem harmless, but can actually put your health at risk. Drinking too much water before bed. Staying hydrated is essential, especially as we age. Our bodies need water to keep organs functioning, aid digestion, and keep our joints flexible. However, while it is crucial to drink enough water throughout the day, consuming a lot of fluids just before bedtime can lead to some serious consequences. As we grow older, our kidney function may decline, making it harder to process fluids effectively. At the same time, our bladders may not hold as much liquid as they used to. Additionally, the signals we receive to alert us that we need to use the bathroom become more sudden and frequent. This means, if you drink a lot of water or other liquids within an hour or two before bed, you're much more likely to wake up in the night to hurry to the bathroom. Now, you might think that getting up once or twice in the middle of the night isn't a big deal, but for seniors, it significantly increases the risk of falls. Imagine this scenario. You find yourself waking up feeling groggy. The room is dark and you are disoriented. Standing up too fast can lower your blood pressure, which can cause dizziness or even fainting. That quick trip to the bathroom can quickly transform into a dangerous fall. In fact, the CDC reports that falls are the leading cause of injury-related hospital admissions for older adults, and many of these accidents occur during nighttime trips to the bathroom. But the risks don't stop at falls. Regularly waking up to urinate disrupts your sleep cycle, particularly the deep sleep stages, which are crucial for mental and physical recovery. Chronic interruptions to your sleep have been linked to memory issues, higher levels of inflammation, and an increased risk of conditions such as dementia or Alzheimer's disease. Poor sleep can weaken your immune system and worsen existing health conditions like diabetes and high blood pressure. Additionally, drinking too much fluid at night can strain your heart, as it has to pump harder to manage the extra volume circulating in your body. For those with pre-existing cardiovascular issues, this added strain can potentially trigger irregular heart rhythms or other complications. So, how do you stay hydrated safely? The key lies in timing and balance. Ensure that you're drinking enough water during the day, but start tapering off in the evening. It's best to avoid large amounts of liquid for at least 2 hours before heading to bed. If you're thirsty before bedtime, try limiting yourself to just a few sips instead of a full glass. Also, be mindful of consuming caffeinated or diuretic beverages like black tea, coffee, or even certain juices late in the day, as they can further increase your nighttime bathroom trips. If you do need to get up in the night, make sure that you are making your route safe. Use nightlights to illuminate your path, and keep any items that might cause you to trip, like shoes or loose rugs, out of the way. Take your time when getting out of bed. Give your body a moment to adjust before standing. With these simple changes, you can stay hydrated without compromising your sleep or safety. Habit 6. Eating late at night. Next on our list is the habit of eating late at night. You might think that enjoying a little snack before bed is harmless, especially after a long day. But for many seniors, this common practice can quietly disrupt health in ways you might not realize. Although a late-night treat may feel comforting, it can lead to a chain of issues that extend beyond just temporary indigestion. As we get older, our bodies start to process food differently. Metabolism begins to slow down, and digestion isn't as smooth as it once was. The body's ability to manage blood sugar and cholesterol also becomes more challenging. When you eat heavy or rich foods late in the day, your digestive system doesn't get the break it needs to rest and repair itself. Instead of allowing for restorative sleep, your body remains active, working to process that last meal, which puts unnecessary stress on your heart, liver, and digestive organs. One of the most frequent issues that arise from late-night eating is acid reflux. Lying down shortly after eating can cause stomach acid to flow back into the esophagus, leading to a painful burning sensation. For seniors, this isn't just an uncomfortable experience. It can lead to serious issues such as inflammation, esophageal damage, or even aspiration pneumonia if food particles are inhaled during the night. An American Journal of Gastroenterology study found that individuals who eat within 3 hours of bedtime are significantly more likely to experience reflux and its related complications. But that's not the whole story. If your late-night snack contains high amounts of sugar or refined carbohydrates, it can cause your blood sugar levels to spike. With aging, our cells become increasingly resistant to insulin, making it much harder to manage glucose levels effectively. This issue can lead to the development of type 2 diabetes or worsen existing cases. Research published in the Journal of Clinical Endocrinology and Metabolism confirmed that late eating is linked to higher morning blood sugar and insulin levels, particularly in older individuals. Moreover, you might not notice immediately how late-night eating can impact your blood pressure. Normally, blood pressure drops during sleep, allowing the heart to rest. However, if you consume a heavy meal late in the evening, particularly one that is fatty or salty, it can keep your blood pressure elevated throughout the night, thus increasing the risk of both stroke and heart attack. In some cases, heavy evening meals have also been shown to trigger irregular heart rhythms, which can be particularly dangerous for seniors with existing heart issues. So, how can you still enjoy your meals without harming yourself during the night? It's about timing and food choices. A good guideline is to finish your dinner at least 3 hours before you hit the sack, allowing your body ample time to digest. Opt for lighter meals that include plenty of vegetables, lean proteins, and whole grains, while steering clear of heavy or greasy options, as well as sugary snacks. If you're truly hungry closer to bedtime, reach for something small and gentle on the stomach, such as a banana, a spoonful of plain yogurt, or a few unsalted nuts. These alternatives are easier to digest and won't send your blood sugar skyrocketing. With slight adjustments to your nighttime routine, you can enhance the quality of your sleep and significantly decrease your risks for troublesome issues like heartburn, elevated blood sugar levels, and excess cardiovascular strain. Habit 5. Sleeping in the wrong position. Moving on, let's discuss the impact of sleeping positions. Each of us has our preferred way of sleeping, whether it's curled up on your side or stretched out on your back. However, many seniors may not realize that your nightly sleep position could be putting your health at risk. As we age, how we sleep plays a significant role in various health aspects, from breathing and heart health to brain function. To start, let's look at one of the worst positions for seniors: sleeping flat on your back, also known as the supine position. While this might feel restful for some, it actually triggers a chain of health issues. Lying on your back allows gravity to pull the tongue and throat tissues backward, which can narrow or close your airway. This is especially problematic for anyone who snores or has sleep apnea. Even if you do not have a formal diagnosis, This restriction can still reduce airflow significantly, worsening any existing breathing issues. Research conducted at the Mayo Clinic Sleep Disorder Center has shown that people who sleep on their backs are likely to experience worsening breathing problems, with a 40% increase in the likelihood of developing obstructive sleep apnea. The consequences of restricted airflow during sleep can be severe. When oxygen levels dip, it increases the risk of serious conditions, including high blood pressure, brain damage, and escalating risks for heart attacks and strokes. A study in the Journal of Clinical Sleep Medicine further found that seniors who sleep on their backs are at a 22% higher risk of cardiac events at night compared to those who sleep on their sides. Breathing troubles are not the only issues associated with back sleeping. For seniors who suffer from acid reflux or hiatal hernias, sleeping on the back can exacerbate symptoms, making it easier for stomach acid to travel back up into the esophagus. This is known as silent reflux, and can severely damage the throat lining. Over time, repeated exposure can even increase the risk of developing aspiration pneumonia or other pulmonary complications. If stomach acid enters the lungs, the long-term effects may be dire, including a heightened risk of esophageal cancer. Additionally, research has shown a worrying connection between sleeping position and brain health. A study from Stony Brook University indicated that sleeping on your back diminishes the brain's waste clearance system by over 60%. This system is crucial for eliminating toxic proteins linked to conditions like Alzheimer's disease and other forms of dementia. The implication is that poor sleep posture could accelerate cognitive decline in older adults. While sleeping on your right side may feel comfortable, it can often compress major blood vessels near the heart, leading to circulation problems and potentially increasing the risk of heart failure. This is particularly concerning for seniors with heart issues. What then is the safest way to sleep? Experts suggest that sleeping on your left side is the ideal position. This posture supports better circulation, promotes healthy digestion, and diminishes acid reflux risk, while making it easier for the brain to flush out waste, essential for long-term mental health. Adjusting your sleep position may take some practice. Consider using a firm pillow between your knees to keep your hips aligned, or tucking a pillow behind your back to prevent rolling over. Also, for those experiencing reflux, elevating the head of your bed can improve your comfort levels significantly. Transitioning to sleeping on your left side might feel strange at first, but the positive health impacts are well worth the effort. By changing your sleeping position, you can significantly reduce the chances of breathing issues, stress on your heart, and cognitive decline, which sets you on a path to healthier, more restorative sleep. Habit 4. Sleeping in a hot room. Next, let's look at the impact of room temperature on sleep quality. Many seniors seek warmth at night by turning up the thermostat, layering blankets, or keeping windows closed tight. While feeling cozy is comforting, many are unaware that a warm bedroom can quietly pose significant risks for older adults. The ideal sleep environment is about more than just comfort. It directly affects health and safety. Your body naturally lowers its core temperature in preparation for sleep. This cooling process helps you enter deeper stages of restorative sleep. Yet, when a bedroom is excessively warm, typically over 70 degrees, approximately 24 degrees, your body struggles to release heat. Instead of comfortably settling into sleep, your system is forced to work harder to cool you down, which often results in interrupted sleep, frequent awakenings, and feeling fatigued the next day. This is particularly concerning for older adults, as the body's natural ability to regulate temperature declines with age. Research published in the American Journal of Geriatric Psychiatry found that seniors sleeping in warmer environments experience as much as 30% less deep sleep, an essential stage responsible for memory processing, support for your immune system, and cellular repair. The repercussions of missing out on quality sleep can snowball, leading to larger health complications. Prolonged sleep loss due to heat exposes older adults to heightened risks for inflammation, elevated blood pressure, and weakened immunity. making conditions like heart disease and type 2 diabetes even more troublesome. Additionally, the impact of a hot sleeping environment can lead to dehydration. Seniors often feel less thirsty, and sweating throughout the night can result in significant fluid and electrolyte loss. Not only does this affect hydration levels, but it can also thicken the blood, raising the risk of blood clots and irregular heartbeats, or even stroke, particularly among those with pre-existing heart or lung conditions. So what's the optimal sleep temperature for enjoying a restorative night's sleep? Experts recommend maintaining your bedroom temperature between 59 degrees and 66 degrees, approximately 15 degrees to 19 degrees. Choose light, breathable bedding materials, such as cotton sheets, and avoid heavy quilts or electric blankets that can trap heat. If you tend to feel cold at night, consider using layered blankets that can be easily removed if you warm up. Additionally, creating good airflow with a fan or slightly cracking a window can help regulate the temperature, keeping your room feeling fresh. Making slight adjustments to your sleep environment can yield significant health benefits. By cooling down your bedroom, you're not just enhancing comfort, you're also protecting your heart, preserving memory, and improving sleep quality. For seniors, maintaining a cooler sleeping space is a simple yet powerful step toward healthier aging. Habit 3. Getting out of bed too quickly. Now, let's address something you may have experienced: getting out of bed too quickly. Have you ever woken up in the middle of the night, swung your legs over the side of the bed, and suddenly felt lightheaded or like the room is spinning? You're definitely not alone in this experience. In fact, for many older adults, making sudden movements upon rising can lead to serious dangers that often go unnoticed. This single habit contributes to countless falls, injuries, and emergency room visits every year. The root of this issue lies in a condition known as postural hypotension, or orthostatic hypotension. It occurs when your blood pressure drops suddenly as you transition from a lying down to standing position. As we age, our circulatory systems don't adapt as quickly to these position changes, which can cause blood to pool in your lower body. This momentary reduction of blood flow to the brain brings feelings of dizziness, blurred vision, or even fainting. This is more than just an annoying inconvenience, it poses serious risks. Research published in JAMA Internal Medicine highlights that seniors experiencing postural hypotension face a substantially higher risk of falls, fractures, and even death. Falls remain the leading cause of injury-related hospital admissions amongst older adults, with many accidents occurring late at night or in the early morning when blood pressure is typically lower as the body adjusts to waking up. The consequences of a bad fall can be devastating. Common injuries include hip fractures, head trauma, and broken wrists, all of which lead to prolonged recovery periods. For many older adults, experiencing a single fall could mark the beginning of a decline in mobility, increased dependency, or serious long-term health complications. Fortunately, preventing these dangers doesn't require drastic measures. The key is to slow down. When you wake up, sit upright on the edge of your bed for a few moments, allowing your body enough time to switch its blood circulation. Move your feet, flex your ankles, and take a few deep breaths to help your body adjust. This gentle movement can minimize blood pressure fluctuations. It may help to keep a glass of water by your bedside. Slow, deliberate sips can also hydrate you, especially if you tend to wake up feeling dehydrated. Additionally, making sure your path to the bathroom is well lit is vital. Consider using night lights or motion sensor lamps to guide your way and improve safety. Avoid wearing slippery socks, and instead opt for non-slip slippers. Keep walkways free of clutter and avoid rugs that might trip you up. If you have medications that can affect blood pressure, such as diuretics or beta blockers, it's also wise to discuss your treatment regimen with a healthcare provider. They may offer guidance on adjusting doses or timing to reduce risk. Making these small changes to your nightly routine can lower the risk of falling and help maintain your independence and safety. So, remember, there's no need to rush the moment you wake up. Taking your time not only helps in feeling better, but it can also serve as a crucial step in safeguarding your health as you age. Habit 2. Ignoring sleep issues. Moving on to our next crucial point, ignoring signs of snoring, breathing pauses, or chronic insomnia. Many people often dismiss snoring as a minor annoyance, especially as they age. However, what if those nightly sounds or the moments when breathing stops signal a much graver concern? For older adults, overlooking these types of symptoms can lead to serious health issues, including life-threatening complications that often go unnoticed. One of the most frequently overlooked but dangerous conditions affecting seniors is obstructive sleep apnea, OSA. This disorder occurs when the muscles in the throat relax excessively during sleep, causing a narrowing or complete closure of the airway. When this happens, breathing can stop for short periods, sometimes dozens or even hundreds of times, in a single night. Each occurrence lowers oxygen levels, putting significant strain on the heart and the body as a whole. The long-term consequences of untreated sleep apnea can be particularly threatening. Data emerging from the Sleep Heart Health Study suggests that untreated OSA can increase the risk of fatal heart attacks by 30% and strokes by as much as 60% in older adults. Alarmingly, nearly 40% of the elderly population is believed to suffer from sleep apnea, yet around 80% of these cases remain undiagnosed. Many simply assume loud snoring or frequent awakenings are normal parts of aging, oblivious to the fact that they may be signals of a serious health issue. But the dangers of sleep apnea extend beyond cardiovascular concerns. This sleep disorder, and the long-term sleep deprivation that often accompanies it, deprives the brain of the deep restorative sleep it desperately needs. As a result, seniors may experience memory lapses, mental fog, and early signs of cognitive decline. Notably, some studies indicate that untreated sleep apnea can accelerate brain tissue loss, particularly in regions that govern memory and cognitive processes, by a rate almost 3 times greater than normal age-related changes. So how can you tell if sleep apnea or a related issue is affecting your health? Often it takes someone close to you, a partner or caregiver, to notice the signs first. Key indicators to watch for include loud snoring, gasping for breath while sleeping, long pauses in breathing, or just waking up frequently throughout the night. You may also experience morning headaches, a dry mouth upon waking, or unusual fatigue during the day, even after spending a full night in bed. Another crucial symptom is insomnia, whether it manifests as difficulty falling asleep or staying asleep throughout the night. While occasional sleeplessness is common, chronic insomnia can hint at underlying health conditions, be they heart issues, neurological problems, or hormonal imbalances. This persistent disruption to your sleep adversely affects your immune system and raises stress levels, making it even more challenging to manage conditions like hypertension or diabetes effectively. If any of these signs resonate with you, it's essential to take action. Speak with your healthcare provider or a sleep specialist for further evaluation. Treatments available, ranging from CPAP machines, lifestyle changes, or weight management, can significantly mitigate health risks. Research has demonstrated that effectively managing sleep apnea can slash the risk of heart-related incidents by up to 42% in older adults. So remember, those nightly disturbances aren't just bothersome. They are critical health alerts. Taking steps to address them can protect your heart and brain health while enhancing your overall well-being as you age. Habit 1. Taking certain medications before bed. Finally, let's take a closer look at taking certain medications before bedtime. For many older adults, nighttime medications are a standard part of the evening routine. Whether seeking relief from insomnia, managing blood pressure, or alleviating joint pain, many believe this process is harmless. However, some of these seemingly routine medications can hide serious dangers when taken before sleep, especially as our bodies begin to process medications differently with age. Let's start by discussing sleeping pills and anti-anxiety medications. Drugs like benzodiazepines, such as diazepam, clonazepam, or alprazolam, are designed to help relax the nervous system and make it easier to fall asleep. Yet they also come with side effects, like slowed breathing and diminished alertness. For seniors, particularly those with pre-existing heart or lung ailments, these effects can pose a serious risk. Research published in the British Medical Journal found that older adults using such medications regularly are far more susceptible to falls, fractures, and significant health complications, including premature death, than their peers who do not use these drugs. The grogginess that comes from their use can linger well into the next day, leading to issues like dizziness, a lack of focus, and an increased chance of slips or falls. Furthermore, sleeping pills aren't the only concern. Various muscle relaxants and certain antidepressants, often prescribed for nighttime use, can disrupt the essential deep sleep stages that your brain relies on to maintain its sharpness. Over time, this lack of quality sleep may contribute to memory problems, confusion, and accelerate cognitive decline. Pain relief medications should also be approached cautiously. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and diclofenac, while effective for joint discomfort, can potentially complicate the liver and kidneys when taken frequently, particularly at night. Furthermore, these medications may increase the chances of internal bleeding, especially when combined with other drugs that influence blood clotting. Another category of common nighttime medications encompasses those used to manage high blood pressure. While some people find benefit in taking these meds at night, others may experience sharp drops in blood pressure while asleep. This can lead to reduced blood flow to the brain, triggering symptoms like dizziness, fainting, or even strokes. Let's not overlook drug interactions when considering your nighttime medications. With age, the body's metabolism starts to slow down, making it easier for medications to accumulate in the system. Mixing sedatives, pain medications, or heart drugs without proper medical guidance can lead to severe health consequences, even life-threatening situations. So how can you safeguard your health? Always consult your doctor or pharmacist before beginning, stopping, or switching medications. Inquire about non-sedating alternatives, particularly if you experience symptoms like drowsiness, mental fog, or morning grogginess. It's also wise to avoid sleep medications unless absolutely necessary, considering natural options like chamomile tea, gentle stretching, or deep breathing exercises to wind down before bed. Should you be taking blood pressure medications, keep track of your readings and notify your healthcare provider of any unusual symptoms promptly. By being informed and vigilant regarding your nightly medications, you are taking vital steps to protect your health, minimize accidents, and improve your overall sleep quality. Thoughtful adjustments can lead to safer nights and brighter mornings. As we close, it's clear that even minor changes in your nightly habits can greatly impact your health and longevity. Now that you know about these 7 harmful sleep habits, it's time to take action tonight. Whether it's managing your medication schedule, adjusting your sleep environment, or paying attention to what you eat before bed, each small shift can support a longer, healthier life. Have you ever unknowingly followed one of these habits? Or do you have a smart tip that's helped you sleep better? Share your thoughts in the comments. We'd love to hear what's worked for you. And if you found this video helpful, remember to like, subscribe, and join our community for more practical wellness tips. Your path to better rest and better health begins right now.